Or the last thing would be that your life or your life fell apart, or the condition came about after a major illness. So let's say you have a flu or you get Lyme disease, and ever since then you've never been the same. Then you've got to think immune system or an autoimmune. Or if after a pregnancy everything really went bad, and that's when I started really feeling bad. Now, when you look at the immune system, there's two parts of your immune system. There is Th1 and Th2. Th1 are your T cells. Your T cells are sort of the cells that go out and actually do all the work. They go out and kill the viruses. They kill the cancer cells. The T cells are interleukin-2 and TNF-alpha. That's your Th1. Th2 are your B cells. They are your antibodies. B cells, they don't go out and actually do the killing themselves, but what they do is they notify the T cells as to what they need to kill. So they say, hey, this is the problem here, we need to kill it. Your B cells are interleukin-4 and interleukin-10. So basically what happens is, if it's autoimmune, we can look at some blood panels and we can see that one side is higher than the other side. You get an imbalance. There's a dysregulation between the two sides of the immune system. That lets us know that there's an autoimmune problem. The other type of autoimmune problem you can have is what's called an active antigen. And what an active antigen means is that your body's been trying to kill something, but it can't kill it. So when it tries to kill it over a period of time, what it'll do is it'll make one side of the immune system go up too high, and that creates an autoimmune problem. An antigen could be any number of things. It could be bacteria, it could be a parasite, it could be a virus, it could be a mold, it could be a heavy metal, it could be a food sensitivity such as gluten, and the gluten creates an autoimmune response in the body because the body's constantly trying to fight this sensitive molecule, gluten, this peptide that floats through your body. So we can determine if it's an active antigen or if it's just immune dysregulation by looking at the ratio between CD4 and CD8 cells. It's called a natural killer cell panel, and sometimes we need to run that for certain patients. Food sensitivity testing. Food sensitivity testing is very important, and basically what we do is we do a test from Enterolab. And what we do is we test you for gluten, we test you for soy sensitivity, we test you for milk or casein allergy, we test you for egg, and we want to look at all of those things because those things can be an antigen which can cause a lot of problems. If you have food sensitivity, one way we can tell, or some of the symptoms that we see patients get, they may get chronic fatigue, they may get indigestion, you may feel bloated after a meal, you may get loose bowels, you may have insomnia, you may get pretty consistent ulcers in the mouth. These are all things that would make you think you have a food sensitivity problem. The other thing that we want to do is we want to look at your intestinal permeability, and we do that test from a company called Genova. And what we do is we want to see how good and strong your digestive tract is at digesting foods and keeping those undigested foods within the digestive tract, because when there are undigested molecules getting into your bloodstream, that can cause an autoimmune problem also. The last thing we want to do is something called a stool microbial ecology test. We do that from a company called Metametrics. And basically what that test will let us know is it'll let us know if you have any parasites, if you have any bacteria, any yeast overgrowth, if you have bacterial problems in that you don't have good, healthy, normal bacteria. Those patients may need to go on a probiotic. So we want to look at everything. We want to leave no stone unturned in determining what's going on metabolically so we can get your body to function better and get you whole and healthy again. Now the question always comes up, do I need every one of those tests? No, because what we're going to do is we're going to have you fill out a metabolic assessment form. And this metabolic assessment form, we're going to look at all of your symptoms. It's going to look at all the different categories. It's going to look at hypoglycemia, hyperglycemia. It's going to look at your digestion. It's going to look at immune. It's going to look at everything. And we're going to see where you've got the majority of your symptoms. And then we're going to base the testing that's necessary based on the consultation that we have with you. So some patients may only need a complete blood panel. Some patients may need a complete blood panel. They may need a lipid panel. They may need autoimmune testing. They may need food sensitivity testing. They may need the whole thing. Typically, the worse off a patient is, the more problems they have, the more testing that needs to be done. So again, we want to leave no stone unturned. Again, one other thing is if we totally avoid the metabolic test, and it comes back, or we find out that you have a metabolic problem, or we don't find out, we don't even look for metabolic, and we only address your problems neurologically and biomechanically, but you have an underlying metabolic problem, it can adversely affect the results that you want. And I know you want to have the best possible results. So you can learn more about this. You're going to get this sheet. It's called What Makes Us Different, How We Treat Chronic Conditions. I think it's in yellow when we pass it out to you. Take this home, read through it. It will go over all the different tests and all the different things that we do in our office to help patients get well. Thanks a lot. We'll go over all your findings at your report of findings.